Thanks everybody for jumping on tonight. My name is Chris Wolf. I'm an optometrist. I practice in Omaha, Nebraska. And what we wanted to do tonight was to kind of get all of you together to get your perspectives about presbyopia, which obviously is, as we have more birthdays, it makes it harder for us to see clearly up close. And so as a clinician, as a doctor, I encounter this all the time in my practice. And it can be very clinical because we understand the process and how it works, and we understand how to fix that problem or help patients fix that problem. And so we rarely dive into kind of the experience of the patient outside of the exam room. Patients often are so busy in their own personal lives that they don't spend a lot of time talking to one another about this. And so we want to make sure that we're facilitating conversations in our offices that are to your needs and being able to find solutions that work well for you. So thanks so much for being on tonight, and we'll get right into the panel discussion. So thanks Cooper Vision for putting all this together so that we can have and facilitate these conversations.
You know, as a lot of other people use a lot of our smartphones and we're on them and just seeing those things are kind of more bothersome the electronics.
Yeah, let me ask you, was there sort of like was it a gradual process for you so far, or was it just like one day I was like, man, I can't stay focused on this?
It's gradual, but I can see that there's been change, yes. Mm-hmm. And it seems like the more you're trying to strain and see things, the worse it's getting.
Yeah. Well, Christian, tell us a little bit about your story.
Hi.
Hey, Christian.
Sorry, I had to take off mute because I was leaving on mute so that the others could, so we wouldn't have sounds.
Perfect.
Pretty much, I have similar to what Lydia what she had to say, that it's more digital stuff that I have issues with, and it's gotten a little bit worse as I've gotten older. So,
Christian, tell me a little bit about, do you think it's digital because you use a lot more digital now, or do you think there's something about digital? I
think it's because you're looking at bright screens. I notice sometimes I darken my screen a little bit to maybe help.
Mm-hmm.
Interesting. Yeah. Okay. Thanks. Layden?
Hey, I'm LaDon, and I live in Alabama. And I recall my vision starting to really deteriorate when I was in 5th grade. I had noticed it earlier when I was in 3rd grade, so I was probably about 10 years old at the time. And when I would be sitting in class, I would just not be able to read the blackboard. I would come up with excuses in order to get out of it because I didn't want to embarrass myself because of my poor eyesight. But it just got to a point where I had to have something done. I couldn't see, and I wore glasses for the first probably 4 years, and then I was able to switch over to contacts. And during that time frame, I noticed that my vision would still gradually get worse over time. It's pretty much stabilized currently, but it's if I don't have my glasses on or my contacts in, I can't see anything. I'm maybe 6 feet from a TV at this very point. If I couldn't see anything, I was actually joking around the other day that if I didn't want to watch the TV, all I got to do is take my contacts out. So
yeah. So LaDon, let me ask you. So you've got kind of a long history of having vision correction throughout your lifetime. Has there been a process recently where you're having a little bit more challenge, even with your prescription on, even with your glasses or contacts, where up close or computer vision isn't as good?
Yes, definitely. I've noticed that the past few weeks. I was doing something. I would just watching the video, and I noticed I would have to really move in just to be able to focus on it, especially on my phone. I'll hold my phone up to this close sometimes just to be able to see things correct, text messages or anything.
Does that make you feel any different?
I'm so used to having poor vision, in all honesty, that it doesn't affect my personal feelings. I do want more options and more correction, I think. I would like to be able to see perfectly, I actually have my contacts with me, and my prescription is a negative 600, and that's actually improved over the years from a negative 750. But I think
Yeah.
it's deteriorating to a point where I'll probably have to go back to the higher, stronger prescription.
Yeah, interesting. So thanks, Ladon. I'll come back to you. I have a couple other follow-up questions. Andy, can you tell us about your story?
I'm Andy. I live in Ohio. I am a drug and alcohol counselor, actually. The vision thing, I've had vision problems. I mean, it started not as young as him, I don't think, but you know, I mean, just I can't see things, something like that. But recently, I know I did a lot of work. I worked at home for a long time, and I would come to my computer and I would look, and like it's blurry, right? Like I'd have to kind of like step back and kind of like, and I'm thinking, am I just tired? Is the computer screen blurry? Like, is something wrong with the, you know? And it's like you sit there and blink your eyes and you think you have something in your eyes, and you're trying to figure out like exactly. This part of it's rather newer to me, so it's I didn't know if it was something wrong like neurologically, or you know, it was kind of bizarre. So
that's really interesting. It sounds like you've kind of adjusted or figured out ways to adjust, moving different distances. And your initial reaction, that's an interesting comment, that is this neurological? Can you dive a little bit deeper in that? Like, I guess when I ask you that, what was your thought process? And then have you sought any other opinions or talked to your doctor about it?
Well, I'm in the process of doing that. I mean, I have other issues going on. But my thought process, I mean, I don't know. I thought maybe I was sleepy, or you know, like I got something in my eye, or you know, and I did think, is there something wrong with me here? Like, I mean, because it kind of just kind of happened one day, you know. It was definitely a weird experience to me to not be able to see when I'm sitting right in front of something, and I'm like backing up and I'm blinking my eyes and I'm rubbing them and I'm doing all this stuff to try to figure out what's going on here. But I felt fine. I didn't seek any like emergency room help or anything like that. But I mean, you know, and sometimes it's not like that. So I mean, you know, but it happens very frequently for me.
And so then, so obviously you've had vision correction before, is that correct?
Yes.
You had glasses, contact lenses in the past.
I had glasses a long time. I haven't worn glasses for years, but contact lenses, yeah.
So then, have you talked to? I know this is more recent. You haven't seen anybody before, but have you talked to your doctor, or has your doctor talked to you about the fact that this process is going to come up at some point in time, or have you done any searching online for this process to kind of learn more about it?
What process are you talking about exactly?
Well, just the process that occurs when we go from being able to see clearly at distance and near when we have our correction on, like when we have our glasses or contact lenses on,
right,
when we're usually under 40, to the fact where it's a little bit more challenging for us to see clearly up close unless we do other things.
I mean, I wasn't really, I mean, I know I had vision issues, but I didn't know, I don't think this was something that it's something new, put it that way.
Would you have
other vision issues?
Yeah, so I think what's interesting to me as a clinician is, would you have preferred to know that this process is going to occur, even if I saw you, let's say last year, and would you have preferred to know, oh yeah, this is going to happen at some point in the next few years? Would that have made you think differently about it?
Completely. I mean, I had no warning that this was going to happen, or no idea this was going to happen, actually. So, I mean, you know, I thought, my vision, I can't see great, like most people, you know, like, and I have contact lenses and stuff like that. But then, like, now it's something new, right? Like, this is different than the previous vision problems that I had, you know, and I didn't have any idea that was going to happen.
Yeah, definitely. Lydia, I'll kind of pose the same question to you. You know, did you have any idea as this started? Were you prepared for the process?
You're asking me?
Yes, sorry, Lydia. Yes, please.
Yeah. Can you just repeat that for a second?
Yeah, when this
Was I
process,
prepared? I
yes.
guess I was slightly prepared, because I see, the eye doctor yearly, except for like there was a pretty larger gap with COVID and all. Um, but
Yeah.
I guess, yeah, slightly prepared, not completely prepared, but yeah, I kind of knew it's coming.
Were you, did they talk about, so were they talking about any other options for the fact that when it was going to come, these are the things that you could do? Because are you a contact lens wearer or
Yes,
glasses
contact
wearer or
lens
both?
wearer. Yeah,
Okay.
contact lens wearer. And then I use readers that are just over the counter readers right now. Yeah, so they had suggested possibly prescription readers or the multi prescription for like the bifocal contacts.
Yeah. Can you tell me a little bit more about your understanding about utilizing a multifocal contact lens or your thoughts about it? In terms of as they presented that
I've heard
to
they're
you.
hard to, yeah, I've heard they're hard to adjust to. They said that, we could look at it in the next, couple of years, whenever I felt that I was ready to try. Yes.
Do you know, like, what's your perspective on why it would be a challenge to adjust to? Do you have an understanding of why that might be the case?
Something about how they have to be lined up when you're wearing the contact. Yeah.
Okay, great. That's really helpful. Thank you.
I've been wearing contacts for like 30, I don't know, 5 years. So for the most part.
Yeah.
So it's a
So
long time.
let me ask you, I'm going to pick on you a little bit more, Lydia, because this is really interesting to me. When you think about wearing your reading glasses,
Yeah.
what percentage of your day are you putting those on?
Not as often as I probably should.
Why do you think that is?
Because it's difficult to juggle it.
Okay.
Because you have to either carry them around with you or have them close by. You have to take them on, you have to put them off, that type of thing. So yeah.
Yeah. That's very interesting. Christian, I'm gonna kind of kick it back to you. You're wearing glasses right now. Are you a contact lens wearer currently?
I do wear them, but I'm not always.
So you're a part-time contact lens wearer?
Correct. If it's like I'm doing athletics or that kind of stuff, because they sometimes bother me, and I would rather not always have them on.
Can you tell me about why you think they bother you? Like, what's your experience about why they bother you?
It's just always having to be touching my eyes, taking them in and out. Sometimes I just kind of get lazy. I'd rather just throw the glasses on. It's easier.
If you are there times when you said you're active and when you're playing sports, are there times when you're doing that you have the same experience? Like, are you playing soccer? Are you playing where you want to be able to see better up close? You're having that same fatigue. Okay, so mostly distance activities.
Yeah.
Okay. All right. Wonderful. Thanks. LaDon, can you tell me a little bit about your conversations with your doctor about your near vision in terms of your correction with contacts?
I've been thinking seriously about what's going on with my eyes, and prior to this year, honestly, I got really thinking about it during the times I would talk with you about my eyesight, and I have talked to him or her, whichever one it is, because I practically use the Walmart areas a lot of times for the vision, and part of it's the fact I'm 47 years old, and I don't want to accept that I'm 47 years old right now. And
happens to the best of us.
Yeah. It's just a matter of feeling older about it, and I know that I'm going to definitely need those bifocal lenses, because when I was talking about seeing things smaller that way, I do a lot of woodworking, and that's one of my hobbies. And if I'm measuring something or looking at something that I'm turning or just cutting the wood with, I have to hold the ruler out like this now, and it's hard for me to see. Oh yeah. And so I'm having to look at things in a whole new perspective because like nearsighted all my life, but now I'm having trouble seeing near. And for me, it's just a difficult thing. And I'm bringing myself to the point of discussing that. My mother has always been farsighted, I guess is the best way to put it. And she never had issues with it. But for me, it's kind of difficult because I've always been used to that. And then I see these changes, and now every little label that I look at, I'm having to hold way out, or it's too small to see, it's too big to see. So I'm looking for that discussion because the next month is time for my yearly checkup, and that's where I think it's really going to be brought out, and it'll be time to face the music, I guess you could say.
Yeah, well, Andy, if I were to tell you that that the process you're going through is normal, how would that make you feel?
I don't want to hear that. I mean, that's great, congrats, but normal for. I what Don kind of said it. I don't want to accept the fact that I'm older and I have these health conditions, and it's one thing after another, and it's it's not just vision, it's a lot, general health, and I'm entirely in my head still 20-some years old, and it takes me a long time to accept certain things, and I oftentimes push things too long because of that, until it becomes a real problem or it affects a certain area of my life that it becomes a realism, I guess, at that point. But yeah,
it makes me wonder if as a clinician, as a doctor, if I'm telling a patient that something's normal, one of the things I'm trying to project to them is like, hey, look, this is not something you need to lose sleep over or worry about. But what I'm hearing, perhaps, at least from you, Andy, is that maybe that doesn't help a lot.
No.
So what would be helpful? How would I describe that to be more helpful?
I mean, to me, it comes down to a couple things. Convenience, right? Like, is this going to be super inconvenient to my life? Am I going to have to, and cost, I mean, price, I mean, my money's always an issue. So, I mean, I've got other medications I got to take. I got, contacts I got to get. I got this, I got to do that, I got to do, so those are more of, you can say it's normal, and that's, I guess, kind of makes me feel better, makes me feel like not an outcast, but what kind of inconvenience is that going to be to my life still?
Interesting. Yeah, interesting.
Am I going to have to do more appointments? Am I going to have to, I mean, life's busy. You got kids, you got all this stuff going on. That's my biggest issue. And I guess just forgetting about it and then putting it off kind of makes it go away temporarily, right? I mean, it doesn't really make it go away, but that's kind of the goal for me, is just like, I'll just pretend it doesn't happen.
Yeah. Lydia, what about you? Sorry, Andy, go ahead.
No, that's it. That's pretty much it. I mean, like I said, I only got one left.
Yeah.
I only have one kid left at home, but at one time I had 4 kids. They have issues. I mean, like you said,
you got to
understand. They have issues. The house has issues. A job has issues. The car has issues. Everything has issues. Like minor things, they, albeit normal, are a major inconvenience.
Right. So what I'm hearing you say, maybe I'm not summarizing this well, but what I'm hearing you say is normal is okay, but if it's going to be an inconvenience, you need a solution that's not going to be super complicated
or expensive.
Yeah. Okay. Fair. No, it's fair. It's fair. Yeah. Lydia, what about you? If I were to tell you this process is normal, how does that make you feel?
I mean, like one of the other panelists said, I mean, there's always these changes happening with age-related changes. I mean, like I said, I kind of knew it's coming. It's just a matter of time. But again, I think something that's going to be convenient and low cost, because even like I wear daily wears now, and it adds up. It's not some, glasses are expensive too, but contacts I think have a higher price tag on them. Especially daily wear, but I trust daily wear, so that's why I wear it. But yeah. I
mean, I think those are all really valid points, and they're I mean, it's interesting to think through the different dynamics of what you all are thinking about on a regular basis that we might not be thinking of. Christian, when you think about your options for correction of your near vision, what are you doing right now in general for the symptoms that you're having up close? You have multifocal glasses or bifocal glasses yet?
The last time I was at, I had my eyes checked. They said that I may need to get bifocals just to see how it is, and after next year maybe look at it, and then I would also need to get bifocals on the contacts, and then like Lydia had said, it's like it's weird, and you know, at least with your glasses you can kind of adjust it, but like for your contacts, I don't know how I would adjust to that. And there's just that additional added expense. I mean, also when you have contacts, you kind of, it's more, when you use them daily, then they're adding up expenses. So just definitely something, a concern.
Yeah, totally. Well, so Christian, if you when you think about the delay or the kind of preparation of when you're going to go to a multifocal pair of glasses or bifocal pair of glasses, what's that conversation been like with your doctor about kind of that preparation? Because it does sound like they've sort of been preparing you for that. And what's your perspective of what they're waiting for those next steps?
I think I think my doctor wanted to prepare me so that it was a point where I was comfortable getting that. You know what I mean? Is it at some points where I'm noticing it's too much of a problem to be taking the glasses off or just, you know, so I'm having that problem. So and also, you know, you have to get a new set of glasses and a new set of contacts and prescription. So it all adds up to, you know, more expenses.
Would you rather than be, so I guess this is interesting to me. Would you rather, because again, we do this as clinicians, and I'm not blaming anyone's doctor on here. Because we do this, right? This is one of the things that we do, is we sort of wait until just like a lot of things, the benefits outweigh the risks or the side effects of a potential intervention. So when you think about this, Christian, is there any way that you think it could have been better for us to start earlier as opposed to just talking about it and maybe doing something in your normal course of updating your glasses or contact lenses, as opposed to kind of keep going and then waiting until it's bad enough? What are your thoughts about that?
I mean, I think my doctor is fair to where he says, when I feel comfortable with it, that we can go forward with it. Was just like getting, you know, do you need to get is your prescription so much worse that you should get a new set of glasses type thing? Like I say, well, is it my eyesight changed that much from last year? Do I need to invest in, you know, because when you get prescription sunglasses, those can be expensive. So you're just changing your whole prescription. So it adds up. So it's like, you know, so I don't know if I really want to always have to every year have to get a new set. And I think my insurance only covers every other year new frames. I mean, it covers the lenses, but you know, so then well, so you think about, well, do I want to do all that? And so.
Yeah, it's understandable. Lydia, you look like you had something you wanted to chime in about. Did you have thoughts on that?
No, I'm trying to think of it, but
no, that's okay. Yeah. Okay. Leon, you have any thoughts about that?
Well, for me, right now, the process, the change would be getting used to the fact of iPhone contacts with multivision or glasses. I've never worn them. I've always worn single vision. I know that's where I'm going to be going in a month, and I've always paid out of pocket, so the cost is not an issue for me at that point because that's just what I'm used to. It's just going to be getting used to to find that little pinpoint inside the contacts that I'm going to be able to look through and find. And that's my main issue, is that I've always ordered mine online or purchased somewhere, and usually I'll buy a year's supply at a time just so that I'm prepared. But now with I've got half a year's package right now, and I know that that's probably not going to be of use to me anymore. And so getting to the point of adapting is going to be what's going to be hard for me, because I've never dealt with that.
Yeah, that's interesting. I don't mean to interrupt, but tell me about the types of questions that you would have in terms of, like, if we were going to, because we've talked clearly about multifocal contact lens options, clearly about spectacle lens options and reading glasses over the top of the contact lenses. But what sort of questions would you have in your mind, like, about a multifocal contact lens, Vidhan?
Okay. First, I would like to know how long it's going to take me to get adjusted to them. Is there a specific way that I need to put them in? Is the outer portion of the lens going to have the multi, and then I see what I normally see through, or is it just a specific point that I look at? Another thing I want to know is how long will this prescription typically last? Is this going to be one that's going to be 1 year, or will my eyes change so much during that year that I need to come in again? What's the process? How long's the process going to be for me to adapt to them completely? What's the cleaning protocol for them? I typically wear the ones you replace weekly. Weeklies is what I wear, bi-weeklies. And is the cleaning process going to be different for them than what I'm wearing now, where basically you soak them in a solution, and a multi-purpose solution, then reinsert? It's going to be different. It's going to be, or are they more prone to damage than traditional contacts? That's some things.
Yeah, that's great. Yeah, that's great. Andy, do you have anything that you'd add to that?
I mean, you talked about what you can do better. I mean, in reality, I only hear what I want to hear sometimes. So you explaining things to me,
we're all the same way.
I mean, I it seems like everyone here is more accepting of their condition or their problems than I am. I will fight this as long as I can. There's
when you say, sorry, Andy, but when you say fight, what do you mean by that? You mean delay?
Fight to accept it. I mean, fight to maybe just accept it. If I can make life work without it being a major obstacle to me, I mean, I will keep going and going and going and going until, so a lot of times it's not that somebody doesn't explain it to me. It's that I don't hear what they're saying to me because I'm just maybe in denial or, so the solution to that, I don't know. I mean, you can talk about it being super important and all this stuff, and I'm just a hard-headed guy,
yeah.
Until I can't physically make, find an alternative solution to deal with it, I'm probably gonna try to not address it. I mean, so it's
interesting. So then what, so when you go in to see your doctor, how would you communicate that to them? Would you just be upfront like you're being upfront with me, or would you just sort of like resist any other recommendations?
Resist is
the reason I'm asking. Yeah, I'm the reason I'm asking is because I think, there's a likelihood that doctors will listen to this, and we need to be armed with kind of the perspective of different people so that we can kind of be aware of, like, this is how they're feeling about this. And not everybody is ready to just like listen to the things that we recommend right away or the things we prescribe. So that's why I'm asking the question. I'm not trying to put you on the spot in terms of like what can we do to twist your arm? I'm just curious.
I wish I had a good answer for you. I mean, it's more my issues than your issues. I understand you're trying to find a work through. I guess just the assurance this isn't going to be this big long. I don't know. We talked about being normal, and you can say it's normal. I didn't like that answer either. So again, I could be being hard-headed, right? Like, I don't know exactly what you can do for someone like me. For other people, I don't know. But for me, I mean, I think it's like, I really don't know what you can do to better communicate and get through my thick skull that, I should probably do this now before it's a major problem, and life would be so much easier. I mean, I was resistant to contact lenses from the beginning, and you know, it took me forever to just even, you know, do that. So yeah, wish I had a great answer for you, but I really don't.
No, it's okay. That's okay.
I don't, like I said, it's in my situation, it's more me than it is them.
Yeah, that's all right.
But
So,
the reason, but like I said, the reasons for that are because they are mainly financial concerns. You know, it's easy to say, hey, you know, come to this appointment next week, or come get this test done, or, you know, well, in reality, I have 2 kids that have to go to another test, a soccer game, but you know, like, so I mean,
Yeah.
it's I don't know how you fix that, but it's life,
Yeah.
right? I mean, but
yeah, I get it. Christian, let me ask you, what are some questions that you would have for your doctor about this process or about a multifocal?
I mean, every time I go in, I ask him specifically what, how he thinks my eyesight is doing, what, like, as long as my eyes aren't, like, you know, starting glaucoma or something. But in general, I've gotten a little bit worse over the last, like, 5-10 years, but he kind of said it's really up to me. Is it so bothersome that I want to transition into getting bifocals so that it's just easier to see?
Is there something that I guess, is there something that we could do that help you understand when that time is ready for you? Like, would give you more clarity to say, oh, this is now I know, as opposed to, like, I kind of put up with it for a while and it's getting a little worse and worse. It's gradual. Is there something that you would look for from us as doctors, or specifically your doctor, that would be like, oh, this would be really helpful if
maybe if there was, like, some kind of I don't know, like a test or survey or something that you would say, how bothersome is this? And then they could bring back your results saying, hey, make sure you answer this honestly. This is what we're showing, that you scored, you know, a 5 out of 10 on how comfortable you are, and how poor, you know, this would, and then maybe have me try on something that's temporary to see if I maybe enjoyed it, or if it helped me more or something. I don't know.
Yeah, that's really interesting. I think that's very helpful. Yeah, thank you. Lydia, what about you? Any questions on the top of your mind that you would want to ask your doctor about this, about a multifocal lens, that you haven't had answered before?
Yeah, I think, you know, the biggest question is like the durability, and also like a trial period where, you know, is there a trial period? Let's say you try it and you've now invested, you know, your time and money into it, and then a few months go by and you just can't tolerate the lens. So then what do you do? I mean, you know, is there a trial period of like 90 days? You can try it. If it doesn't work for you, you know, a different alternative brand or something. And how durable are they? Like one of the other panelists said, are they gonna last like 6 months, 1 year? I mean, you know, I think that would be good information to convey to potential use, you know, and trial of it. So
Yeah, I think that's helpful. I think, you know, as a clinician, we think about these things often, but we sort of don't. We may not be communicating them as well, and so kind of hitting those points about durability, hitting the points about the fact that there is a process of adaptation, which we know, but then you know, there's also, even to Andy's point previously, is that, you know, I can know, and even Christian's point, I can know that this is going to be working for me before I even, you know, before I'm having to kind of go it all in, I suppose. Yeah. So, yeah. Okay. So then, how much have you talked? Well, do you ask these questions to your doctor? I mean, are these open dialogue questions that you have, Lydia?
Not as in depth yet, because I think, you know, it's like we're there, but we're not there yet. Let's put it that way. So I do have a visit coming up, and I think it will be part of that conversation for sure this year.
Yeah. Do you think you'd want like more information in the form of, like, first of all, more information? We asked this, I talked a little bit about this at the beginning, but would it be helpful to have more information in terms of a timely standpoint earlier on in the process, or more information like, oh, hey, we know your appointment's coming up, here you go? And then what type, would that be part of the things that you would want? And what might that information look like that would be helpful to you?
I think it would be better to have it earlier on, have all the information presented to you earlier on. Yeah, so you have time to kind of process and prepare yourself for, you know, the decisions you're going to make, you know? So.
Yeah, Christian, did you have something you wanted to say? It's the mute function, sorry.
Sorry, my dog's barking.
I was
ahead,
answering the question, like I was seeing the chat come up, and so I was trying to answer that question and then go back to you. I know I don't have any.
Okay.
For you.
No, okay. Landon, how about you? Any information that would be helpful for you to make that decision, or how it would be delivered, maybe even? Lidon?
Could you repeat the question? I was replying to the chat.
No, it's okay. So I think one of the things that I'm trying to hammer down is, are there other things that would be helpful from your doctor to get information in terms of well in advance, shorter term, or, I mean, to help you make a decision whether or not this is an appropriate treatment for you?
Well, for me, when I practically realized I had a scratch on my arm about 2 weeks ago, and when I held my arm up to look at it with my contacts in, I could very limitedly see it. But when I took my contacts out, so I felt like it kind of balanced my nearsightedness and my farsightedness out, where I could see where I was at. To me, that kind of let me know that it's to that point. But I would like to have some information from a doctor specifically about the actual health changes going on with my eye at the point, and about maybe even at the age of 40, because it seems like a lot of people say their eyes change at 40. I have a friend who never wore contacts in his life. He said the day he turned 40, everything went downhill. And for me, I'm to the point where I would be more than happy to discuss anything with my doctor when it comes to my eyes, because to be honest, that's, to me, one of the things I've always been terrified of, is losing my eyesight.
Yeah.
So if they can provide me with information, maybe videos, pamphlets, flyers, the changes going on with my eyes, so that I can be prepared, that would be more than welcome to me.
Yeah, totally. Well, so Andy, I'm going to have you kind of, we're going to wrap up a little bit. I'm going to be respectful of all your time. This has been really helpful for me. Is there sort of like a parting thoughts that you have in terms of kind of your perspective on what's going on and how we can be helpful as clinicians, and the types of things that you might want to see in the future?
Certainly, I think a lot of times it's not just the eye doctor; it's any kind of physician, I guess. Because I always feel like there's a disconnect, kind of. It's like, hey, running it like we talked about. I don't want to keep beating the dead horse, the convenience, but a lot of it comes down to cost, right? Not all of that's a big issue for most people. Medical care in general is expensive. So what are we expecting cost wise? What's the long-term ramifications if I put this off? Convenience wise, I mean, what's this consist of? Do I have alternatives? Stuff like that. I mean, just communicating those kind of things, and being mindful, I think, of people's situations and stuff like that. Insurance coverage, is my insurance going to cover this? I mean, not that that's really on you, I guess, to figure out, but I mean, those are the kind of things that I want to know And I want you to be able to, as a doctor, to be able to at least, comfort me, or I don't, comfort's not the right word, I guess. Maybe reassure me that, this isn't the end of the world.
Yeah.
This is your options. But be mindful that, I have other things, other obligations in my life, and other things that take my money. And I know, that's the best I got.
Yeah, I get it. It's great. Lydia, what about you?
What was the question? I'm sorry. About.
Oh, just, sort of in your process, the things we've talked about tonight, is there sort of some summary points that you can glean in terms of your perspective about presbyopia, your thoughts on multifocals that can help us maybe understand where you're coming from a little bit better, and the types of things that you'd like to be communicated. Sorry, my internet's a little unstable. And be communicated to you so that it can be helpful.
Yeah, I mean, like I had said before, maybe, and a few years prior to, I guess the 40-year-old range is probably a good time frame to kind of present those ideas. My prescriber, he's always been pretty open about things, but he is also, I want to say, he's been practicing for many years, and I've seen him for many years. He's recently retiring, so I am moving on to another prescriber in the same office. But I think experience-wise, I think he's a lot more open-minded and presented information better than the newer prescriber. So I think
so sorry, I want to interrupt that just a second. Can you articulate that just a little bit different in terms of styles? Can you tell me a little bit more about the style? Not you don't have to talk about the older or the younger, but
right.
What style do you prefer, one over the other, and why has that made a difference to you?
I want to say he's like more old-fashioned, and he even writes things down. He's not on a computer. He actually writes things down and just.
And you like that?
Yeah, I do. Yeah, I do. I do.
Yeah.
But I think that it was never like, there wasn't a lot of, there was more time, it felt like, versus like now you're kind of just going in and here's your information and here's your script, and see you next year type of thing. And it just felt like there was more time, and that things could be explained more thoroughly, or questions. And that's, I guess that's my opinion.
Yeah, no, that's helpful. Yeah, I think that's helpful, just in general, from your perspective.
Yeah.
Christian, what about you? Are there any kind of thoughts and ideas you have to sort of summarize your experience and some of the information you'd want from your doctor about a multifocal contact lens to make the process easier for you?
Maybe like how that would be on contact lenses, also on how it is on glasses, and like how long it takes to get kind of used to that you have that, like you're looking down and you're seeing that different prescription, basically, not prescription, but like it's different on your glasses. So it's it took me a while just to get used to glasses. I mean, when I first had them, I was just like, whoa, everything's so clear. So I think that would just be kind of like something that you're kind of hesitant to see how that's going to be. And that's why I was saying maybe it would be good if there was some way to have like almost a trial thing, or some way to see how it would be. I don't know.
Yeah, great. Yeah, Ladon?
Well, for me, one of the things that would help me make the decision more clearly, I guess you could say, as a clinician, you'll know the exact component I'm talking about. But when they take and flip the lens, which is better, one or two, have some fine print on a piece of paper for you to read, to show you how much more clear and precise it will be just by using the bifocal lenses. Right now, I'm experiencing a little bit of a halo effect or in my contacts right now when I see light. So, will that disappear when I'm wearing the bifocal lenses? Is a question I would like to know about, that I would like a little more explanation on. And I'd like another explanation as to the health of my eyes. Or will they get worse if I don't do something now, or will they get better? I believe it basically boils down to the elasticity of the lens. And will this relax the lens a little bit over time, or what's the long-term health effects? I'm practically all in right now because, like I said, I don't want to hold things out to here to be able to read them. Whereas without my contacts in, I'm leaning into everything. So I
Yeah.
want that happy medium. I want that balance.
Yeah, great. Well, let me open this up to any of our. I see some of our panelists have had questions, or some of our media correspondents have had questions. I'll sort of open this up to them. So I don't know if the best way is through the chat function, but if you have a question, if you're with one of the media groups that like to ask a question to the panelists, please type your question, and I'll relay that to the panelists. I want to provide you with an opportunity to dig a little bit deeper into something that I may not have gotten to or dug as deep as you'd like.
If you'd prefer, I believe you can also unmute yourself. So.
Yeah, that's fine too.
Yep.
Gretchen, please go ahead.
Yes.
I just opened my mouth. You didn't even hear me say anything. Wow, you are good. My question to the panelists is, what one thing do you really wish that your doctor had told you but hadn't? And I know we've danced around this a little bit and you've talked about what information you want to hear, but if you could just think back to one thing that, gee, I really wish she had said this, or she could have mentioned this so it wasn't such a surprise. If you had to pick one thing, what would that be?
Lydia, we'll start with you. Go ahead.
I guess it would have to be that the daily wear contacts that you're wearing isn't going to be a forever thing. So you would have to choose between a multifocal contact or bifocal glasses, I guess. And, or you can switch between and wear the readers. So, which is kind of cumbersome. But I think something, to that effect, that, over time that you're gonna have to change. It will have to be a change. So.
Are you indicating that you'd have to either choose like a non-daily wear contact versus a pair of multifocal glasses?
Yes.
Okay.
Yeah.
Well, I can tell you, Lydia, you don't. You don't have to give up a daily wear contact for that. But that's for you to talk to your doctor about.
Okay.
So Andy, what about you? We'll kick it to you. What about Gretchen's question? Is
Again,
there one thing that?
Good.
No, please.
Again, whether it's Andy doesn't listen correctly or it wasn't explained to me, I wasn't really aware of a lot of this stuff, and maybe again that goes back to my hard-headedness, maybe possibly. But I think the importance of, and maybe even the timeline of, what this is going to look like as we go through the aging process. I guess everybody's different. So, but in general, in a general sense, and what's that mean for, my health, my eye health, I guess, and my vision.
Yeah.
I feel like I wasn't explaining hardly anything. So, this is like, then again, I go to the doctor and say, fix me, and they say a bunch of words and they give me something and I do it. That's all that really happens to me, but I'm sure there's more stuff.
Yeah. It's on us too. For sure. I know I don't explain things like I should often, and I always need to make sure I'm slowing down. To your point, Lydia, making sure I'm articulating things well and making sure I'm explaining things clearly, because I know that you know, that I can glaze over things, unfortunately, occasionally. So maybe one of the things that, so Ladon, let me ask you the same question. Is there one thing that you think this would have been really a great piece of information to know, or that you wish they would have talked to you about sooner?
I really wish that instead of the focus being on the nearsightedness that I've experienced most all of my life, that there will be a change possibly, and that once I first experience that change, that maybe I should let them know more so than trying to deny the fact that I'm 47, I guess you could say. And I would like for them to just essentially address the changes of my eyes, let me know, or assure me that my eyes are still healthy, and let me make basically give me the information that I need to make the right decision, so that I can have the happy medium, I like to call it, of vision. To me, vision is probably one of the most important assets. So to me, it's just basically assure me what's going on, the changes that I'm looking at, and the changes are normal.
Yeah, great. Christian, last one. What do you think? One thing that,
I don't think I realized when I was first getting glasses that I'd have to be changing my prescription so much, and that I don't know, I felt like maybe I should have had more of a timeline presented to me, like, hey, you're going to need, at this point, you might need to get like a bifocal, so you have at least some, I don't know, maybe a way to prepare, and then you can maybe evaluate, okay, well, maybe I want to plan that I'm going to need a new set of glasses so you have more of a way to plan for the changes with getting new contacts and eyeglasses.
Yeah, that's great. Thank you. Any other questions from our media participants?
Yeah, this is
Jim.
Jim.
Did you have a question?
Yeah, I was wondering if any of the panelists, if any of their friends, family, or coworkers have discussed presbyopia with them, or if they received any information from any other sources like those.
Anybody have some insight there?
I mean, I will discuss it with my family, but as far as anybody bringing it up to me or having too much of a knowledge about it, I mean, I think, we like to use terms and names and presbyopia and astigmatism and all this stuff. A lot of people are like, I can't see and I can't. My vision's blurry. So I mean, I don't really have a specific, but I remember talking like, hey, telling people like, it's hard for me to see, like I'm doing all this stuff. That's my favorite thing to do, is like bounce back and forth and, try to get something in focus. Right. But yeah, no direct conversations directly about it, I guess.
Any other conversations from members or friends that have gone through this with any perspective?
Well, as I said earlier, I talked to a friend of mine who said that after he was 40, on his 40th birthday, he had to immediately wear bifocals after he'd never worn glasses or contacts his entire life. And this is kind of a funny thing, but I was looking at a label and was with my mother. She noticed that I was holding it out, and she said, "You're getting old, son." And then also my sister, who points out, she's a great person, loves to point out some of the idiosyncrasies I may have or something, but she also saw me holding my phone out at a football game a few nights ago to see who was actually sending me a text. And she said, "I thought you were nearsighted." I said, "I think I'm beginning to finally realize that I can't see in any point position." So.
Yeah, and I think that's a thing. Like a lot of people are just like, we use general. It's just a lot of general conversation. You're getting old. That's you're getting old. Your eyes are bad. That's more, at least in my case, the conversation.
Okay. Yeah, Great.
I've had similar conversations with my mother. She'll be like, have you been to the eye doctor recently? Because you're holding your phone away from you or something like that. And so I said, oh, yes, I have my next appointment is blah, blah, blah. So, but yeah, that's definitely happened multiple times.
Lydia, any other thoughts on that?
And I know a lot of coworkers, they do wear the readers at work, but I wouldn't say that they have corrective eyewear to begin with. Like they're just becoming, you know, they just need the readers for a lot of the iPad work we do. So all the documentation is on iPad. So, and it is pretty small and
is there any communication? I want to ask you. I know this isn't the exact question that Jim was asking, but is there communication back and forth among you about, oh, you know, my doctor told me to do this, or my doctor told me to do that, or this is what we're doing here or there, or is it just something that everybody's sort of found their own solution for so far?
Yeah, I think it's just everybody's found their own solution. Yeah. Yeah.
I think there's a lot of things to talk about in life besides vision. I mean, honestly, I mean, you know, where like, you know, we all have issues, and it's like, you know, my doctor did this, my doctor did this, you know, I don't know how in depth we're getting on a lot of this kind of stuff.
Sure. Yeah.
I realize from a doctor's standpoint, that's, you know, that's your life, but to us, it's just a tiny little piece of, you know, lots of other things. So.
Yeah. What I'm mainly trying to understand is like, you know, because we get patients that come in and they'll say, you know, my friend, their doctor did X. I wonder if I'm a good candidate for that. And so I'm just wondering if that's like part of the process with Lydia's group of people that she was mentioning, all were wearing reading glasses. Did they all just sort of pick that up from each other, or were they having conversations about different guidance? That's mainly what I was.
I understand. I was just, you know, trying to make it understandable that like a lot of times we don't dig too deep. We don't dig too deep into stuff, you know.
Totally right.
So,
Totally right.
Yeah.
Yeah. Totally get it. Yeah. Well, thank you so much, everybody, for being on, for your time tonight. This has been really helpful for me. I've gained a lot of perspective from each one of you. So thanks so much for doing this. Again, thanks to Cooper Vision for facilitating all of this. Thanks to the media panelists for jumping on and giving us your questions and your insights. And I'll let you guys get the rest of your evening.
Thank you.
Please have a great evening.
You too.
Thanks a lot. Appreciate it.